This is Let's Talk MS, the podcast of youth living with MS.
Let's Talk MS!
Welcome to Let's Talk MS, a podcast series created by young minds for young minds and proudly brought to you by the European Multiple Sclerosis Platform. We are
Elisabeth
and Anna, and we'll be your hosts for today.
In this podcast series, we're about to unpack the intricacies of living life as young adults while navigating the challenges that come with multiple sclerosis and the related conditions, such as NMOSD and MOGAD. From dating to nutrition or dealing with MS stigma, we are here to navigate it all through experts' insight and personal stories.
Today, we will be talking about mental health. Let me introduce our guests. We'll have Yolanda Higueras, a PhD neuropsychologist with over 20 years of experience. She has been researching MS since 2014 and has also collaborated with EMSP on several occasions, such as the previous edition of the Young People's Festivals. Welcome, Yolanda.
Thank you, Anna. Thank you, Elisabeth. I'm so glad to be here with you today.
And we'll also have Janneke Knol. She's a member of the Young People's Network of EMSP from the Netherlands, where she also coordinates the youth group within the National MS Society. Welcome, Janneke.
Thank you for being here.
So, to kick off this conversation, I will just shortly introduce the topic that we are going to talk today. Living with multiple sclerosis and related disorders means dealing with many physical challenges. However, what is often missed is the emotional impact it can have. Mental health plays a huge role at different levels, from managing the symptoms and maintaining the overall quality of life. It is just important as physical health, and yet is too often sidelined.
Thank you, Anna, for introducing this topic. Mental health is really important, as you were saying, and one of the crucial moments that is highlighted in the journey of the MS patients is often the moment of diagnosis, which is described and often compared to a grieving process. Maybe, Yolanda, can you tell us a little bit more on how can diagnosis of this kind of conditions like MS or NMO and MOGAD can affect the young people and their quality of life?
Well, that's a very good and long question to answer, but to keep it short, I would say I want to share two ideas. The first is that it's not usually that bad. I want to break this idea of the negative impact. In my experience, obviously it's not good news, that's obvious, but sometimes it's not that bad to know the name of the thing. Meaning that sometimes when you've been dealing with different doctors and trying different tests and doing different medical testing, by the end you just need to know, you just want to know what's going on. And sometimes knowing what it is not that bad. I want to share this idea because it's not frequently shared in this group of people with MS, but it's important for you to know that it's not the end of the world. Sometimes it's even positive for you. And keeping that in mind, the second idea I wanted to share is that obviously when it's really impacting you, because, sometimes it's good to know, but sometimes it's not that good to know. When the diagnosis really impacts you, there's a lot of things that you can do. And I hope today's talk is giving you more hints about exactly what to do. But the main point here is not losing the control of your life.
That's a very nice and positive message that you have here when compared to what we hear often. And it's true that often we hear more the bad cases or the worst cases where there are other perspectives, and it's really nice to see that it's not the only perspective. So, but still, very good question, and we will hope during this discussion also, it's also to understand how we can educate people to understand better this kind of diagnosis, so that they are not, in a way, already first name said, and they go into directly in the negative thought process, where there could be some information available and education available to support them better.
Thank you, Elisabeth. But Yolanda, you said something that I think that most of young people or people in general with MS has thought that when we are diagnosed, it's like, okay, it's MS. Of course, it's not a good thing. It's better to have nothing. That's for sure. But at least it's not something else that we think in that moment that it can be worse. So I had this thought when I was diagnosed, but I had never put words on this general feeling. So thank you for sharing, because it's really important.
Yeah, I think it's important for people listening to this podcast that you suppress a lot of ideas, because maybe you think is something weird that you think yourself. It's not weird. There are people out there thinking the same thing, so expose it, talk it out. It's okay.
Yes, you're not alone.
Mm.
Everyone deals with something. We all share the same diagnostic or something chronic, some other disease, but we all have the same emotions and go through the same roller coaster.
Janneke, how did you experience that moment? Did you also have this kind of feelings or thoughts?
I was very happy when I was diagnosed, because it was a long journey to finally know what was going on. I think it took about 5 years before we knew it was MS. So yeah, for me, it came as maybe it's not everyone does agree with it, but it felt more like a present, because I finally knew what it was and why I was feeling the things I felt, and all the emotions I had and what was going wrong in my body, all the things that didn't work. So I was happy with it. My family wasn't. They had struggles accepting the diagnosis, but for me it was kind of good news. But then after half a year, I had my emotional breakdown, and then the negative thoughts came around the corner. So at the beginning, it felt good to finally know what was going on, but after a year or so, I asked for help.
That's great that you could have asked for help. So in this mental breakdown, what did it help you to get better or improve your mental health?
Yeah, I asked for a rehabilitation program, and there was a big team of therapists around me. So I had a psychologist and a physical therapist, a speech therapist, psychiatric. All those therapists were there for me. It helped a lot to know that I wasn't the only one. What Yolanda already said, we're not alone in it. That's what the psychologist told me many times. And at my rehabilitation in the Netherlands, we have also many group sessions available. So then you also see that you're not alone in it. Everyone has its own story, of course, but yeah, it's better to see with your own eyes in real than just to hear the words that you're not alone.
When you're talking about asking for help, I think that's very important, because many people don't feel comfortable asking for help. They have difficulties to acknowledge or even identify there is an issue, and they don't know what to do. Did you have people around you that helped you identify who could be the support that you could have? And how easy was it for you to get to the healthcare professionals?
Well, the healthcare professionals and the system in the Netherlands is very good. So it was, I think, in 6 months that I got the help I needed.
Maybe to jump on this, because in general, the existing evidence from the MS Barometer and other similar surveys that we have done shows that across Europe, there is a huge issue in terms of access and affordability of the mental health professionals. And that can be very challenging for the patients in this journey. And for young people specifically, they might only be in contact with the neurologists or the MS nurses, and not necessarily with the rehabilitation team, as it is the case now. It is very good practice example from the Netherlands. But is there any tools that the healthcare providers can offer to the young people to help them accept this new situation and manage better the stress of the diagnosis? And maybe I can ask this question to Yolanda. In your systems also, how does it work? Do you feel that there are some challenges in Spain for the access to the mental health professionals?
Yes, we do. The access to help is not very fluent from the public service. But on the other hand, we do have patients associations work. They work very good here. They're so professionalized. So people with MS gather in groups, and they create these kind of foundations or associations, and they hire professionals that will help different from all points of views, like psychologists, neuropsychologists, logotherapists, social workers, physiotherapy, all of the things that someone might require over the way of the disease, they will be there. So that's a big help here in Spain, because the MS units at hospitals, they usually have professionals, but the differences between one place to the other could be very huge. And when that happens, the fastest access of patients usually is the neurologist and the nurse. This is the basic equipment that we do have in public services. And the tendency now is to educate them to transfer cases to these resources. Transfer correctly. And to do that, we need to know this person with MS and their needs. We need to know a bit more. And in that aspect, neurologists and nurses are doing a huge effort to train themselves to do it better and to communicate better with these kind of external resources, because at the end of the day, they're like the external hand of the neurologist working in the same person, but outside of the system. So it works really good, but unfortunately is outside of our control sometimes.
Because you've been in the field for a long time, do you think that there was a time where there was a transition from working in silos and then the patient's organization integrating within their services, those kind of not complementary services for the people like mental health, but also social workers, as you mentioned? And do you feel that this kind of transition was challenging, or what was the main challenge for the patient's organization to be able to do so? Because I really believe that also for our audience, because they will be listening from all across Europe, and they will say, oh, maybe, but she's lucky, she lives in the Netherlands, they have access to very nice facilities. But what was the transition phase, and how could we overcome that to have the possibility of having better services available?
There are 2 points here, very important ones. The first is concerning to the person with MS, and the second is concerning the health system. There are two responsibles here. The first one is for the person with MS to approach the services. This is sometimes really hard. This is something that they personally have to figure out they can do it, and they won't do it. Otherwise, it's not going to work. So to make people with MS understand that going to these kind of external resources is sometimes it's hard, because especially for young people, they think about these kind of external resources in a negative way because they're afraid of seeing things. So that's the first difficult point, to explain them the reality of these kind of resources and how useful they can be for them at the beginning and all the way. So that's the first difficulty. And the second one is to actually make aware to health professionals on what these kind of external resources do for the patients. So they should know how professionalized these kind of resources are and what exactly can they do for their aim to help people with MS. So knowing that there are 2 points with a lot of room for improvement is good, because it will help us to improve this kind of transition better.
Yeah, and I think what Yolanda already said is when there are short lines between the different therapists, like the neurologist, MS nurse, or psychologist of whatever person is there for you, when there are short lines, then the patient can be more centered in the whole story. And if all those therapists are aligned with each other, and when the MS Society and the therapist find each other, when they can make each other stronger in what they do and empower and create more awareness of what they can have on impact for each other, all to create the patient to be central in the story and to lower the step for the patient to ask for help, just to raise more awareness about the topics, and not at the moment when you speak to the neurologist, when you get diagnosed, but also afterwards. Just keep all those lines short and try to find each other.
I think that's a very good message also, that we see it's how to lessen the burden of the patient who is already going through his own medical, clinical pathways, and also the mental health challenges that can come with the diagnosis. And so by offering services, by making sure that the finding solutions is easier, it indeed lessens the burden on the patient. But for this, we really need to break the silos. And we have a lot of existing silos in many countries still existing, not just between the healthcare professionals, that's already something, but also between the health and social care professionals, because I think it needs to work hand in hand when we're talking about social inclusion and quality of life, and it all comes together. So there is a need for more discussions to be able to provide a platform to exchange, to understand what are the needs and the real challenges of the patient in that specific environment or country. And so I guess that's a work for organizations like EMSP and the National MS Society. But it needs to also be pushed by the patients themselves, but also by the professionals. And it would be very important to work together in shaping those messages.
Definitely. There are a lot of main protagonists in this movie.
Yeah.
That's for sure. And each of us we have all our own roles, and we have to keep pushing this message to improve, to achieve better rights for patients. And Janneke, one question in your case, for example, that you mentioned that you received psychological support. Was it covered by your country's security system, or did you have to pay it out of pocket? Because sometimes...
No, it was covered.
Oh, okay.
Yeah.
That's really important to have these possibilities. Because, for example, as Yolanda was mentioning, when I'm from Spain, so when I was diagnosed, I had the possibility to, in my case, for example, the psychologist of the Catalan MS Society, I think it was like somehow integrated inside the hospital. Mm-hmm. So I didn't have to go to the MS Society. I was inside the hospital, just where I was usually going. But it's not the situation of many people that I have met.
No.
Also from Spain that go to different hospitals.
We do have a special MS code of chronic disease code here at the healthcare system, but not everyone knows about the code. So there are probably many people who don't know about it and still pay for the costs because they are in the wrong package deal with their health insurance. But when I was lucky that my
interesting.
The professionals in my area knew about this code and told me, when we put you on this, then everything is
covered.
Yeah, exactly. Thank you.
That's very interesting, and I hope, like, for the audience also, if they are from the Netherlands, they keep note of this. That's important that they are in the right bucket.
Ask for the code, guys.
Exactly.
Yeah, and it's for everything within the rehabilitation program. So it's all those healthcare professionals are covered under the code.
Well, I think that's because it depends on the systems. But I know in Belgium also, when you have specific conditions like MS, they're covering more reimbursement. So it's really a good way to manage, also to get to your insurer or to your healthcare insurances, to discuss with them, to tell them what's going on, and to get as many information as possible, and from your healthcare professionals to help you in these admin challenges that comes with the management of chronic conditions. And the better you will be equipped with the right information, the easier it will get for you to get access to the different services. So don't hesitate to engage in the discussion with the different stakeholders you are facing in this journey. I think it's very important. Maybe a question first for you, Yolanda. What do you think that the living with this kind of conditions, which is very unpredictable and a lot of uncertainty regarding your life, I think it impacts your dreams, it impacts your vision of what life could look like, especially if you're the only one with MS in your family and you don't know anyone else. So do you have any coping mechanism that you can share with us that could be recommended for the people with MS or similar conditions?
To me, this balance that this kind of diagnosis may cause is basically due to two things. I'm always giving you two. Have you noticed?
Yes.
I'm keeping it simple. Two things. The first is feeling alone, feeling that you're so different and strange, and that thing happens to you because any reason that you can think about, coming from all your fears and mining your mindset. Feeling alone is not good, and actually it's not real. So it's something that you can change easily And you can change that, just get information or sharing with mates on your same situation, or get into psychotherapy to understand things better. So feeling alone is something really negative with an easy solution. And the second one that might impact your mental health is going to be the feeling that you're going to lose control of your life. This is really breaking down your future plans, changing your whole perspective about you want to be in life or life decisions that you have to make. And this is very frightening. But it's also not true. It's another wrong message that has to be modulated. Your life is going to change for sure, because you're going to have another stone in your backpack if you wish. But it's not necessarily very heavy. And things here has changed a lot in the last 10 years. MS being here to stay means that you have to take care of you, and that's your responsibility. And responsibility to young people sounds like really heavy, but is one perfect way to get back to control your life again. There's something really bad for you is the feeling that you can do nothing about it. And it's not true. You can do a lot of things. I like to explain this to my patients saying, you are welcome to this team. In this team, we are going to do something, but you have to do something. This is teamwork. You're not here to listen. You're here to work with me hand by hand. And getting back to this control of your life, giving them back the control of their own lives is something really positive for a better mindset. And it's what they have to do. So if they do it correctly in teamwork, the future impact shouldn't be that bad.
Thank you, Yolanda, for this answer. And reflecting on what you're saying, yes, it's a responsibility of the patient to be able to take that first step. But isn't it true that it can be very difficult, that first step towards the right direction can be really, really challenging, and that's in a way when people are coming to the psychologist seeking for help, they are also looking for some kind of magical trigger. And so how can we encourage people to take that step? Do you have any recommendations that will help those people? Because I often see that the first step would be the most difficult one in terms of getting triggered and motivated.
Well, probably Janneke can say something more useful than me because she did it, and maybe she can share how she did it. But my suggestion here is, well, my honest answer here would be, I don't know. Because every single person with MS is going to be different. And there's another aspect to be considered here, which is the amount of information they know about it, and which is the amount of information they want to know about it, which is really another very important point here. You don't need to overdose information to someone that is not ready, because the impact is negative. So it's certainly tailoring, it's a very tailored situation for every single person with MS. But once you know the person, once you know what they know about the MS and what they want to know, is the right moment to suggest, because it has to be a suggestion, it's not mandatory. You have to suggest, okay, do you feel that you need help? And if they positive response yes, then it's easy. But if they say no, I always ask them, well, try yourself first. And if you can't do it, come back and ask for help. Because this is a way to make little steps, 1 step, 2 steps, 3 steps, instead of going all the way to something that is unknown for them. I try to give them the possibility to try first, which I know is not going to be 100% successful. Sometimes I got some surprises, but at least you give them the chance. And then when they see the difficulties, they are clear now. Doubts are gone. I can do it alone. And then that's easier for them to ask for help. That's usually my suggestion.
I completely think the same. I see that it's like a journey. And in this journey, you need to go step by step. And at each step, we should receive the information that we need at that time. And now I remember when I was diagnosed, I was 23 years old, and a former colleague was like, do you know, when you will get pregnant, you will have a relapse. And at the time I was like, I was like, my life had just changed in 1 week. I didn't need this information. So it's true that the control of the information, sometimes it doesn't depend on us. But like, for example, in groups like YPN or MS societies, I think it's important that we guide newly diagnosed to this MS journey, thinking about the information that they receive. But Janneke, if I can ask you, like, in the sense, how do you balance living in the moment while planning for the future?
I really live from day to day because I think the future, I don't know a lot about the future because every day can be different. Tomorrow can be a bad day or a very good day. I don't know. So that's why I try to live day by day. The big future things like getting pregnant, start a family, buy a new house, are just the small big things like doing the groceries for a week. And I have to plan those things ahead. And those are all small steps which take time, but I can plan ahead. And I try to see the small, beautiful things in those little daily tasks. For example, if tomorrow is a bad day and I do have some groceries I need to get, then I try to give myself the feeling of, okay, I got out of bed. I could have stayed in bed, but I got out. So that's my first baby step I made through the day. And then I try to see all those baby steps. And then at the end of the day, maybe I did the groceries myself, or maybe I asked my neighbor or my friend if they could get it for me or something like that. And that's what I learned in therapy and from my neurologist and everyone else around me. I speak very open about the situation. And then I noticed that when I talk open about the mental health or the issues I struggle with, other people start talking too. And then there's a conversation, and then you learn, okay, I'm not alone, but also how can you manage all those small steps you need to do in a day. And I also learned in the grieving process that you are allowed to be selfish. I always thought that being selfish was something bad, but now I know it isn't. You need to get yourself on number one. You are important and you are allowed to be you in just the way you are, with all the small baby steps you need to take on a day and all the luggage you have to take with you, how heavy it is or not. Yeah, I think that's how I try to live day by day.
Thanks for sharing. That's a really impactful message and really important. The idea of baby steps, sometimes we forget to give them value. And then these baby steps are the most part of our lives in general. So thank you for sharing this message. I think that's a really, really good advice for those who are listening to us.
I want to thank Janneke for sharing this. She explained very nicely the idea that I gave a minute ago, which is responsibility. I said you have to take responsibility, and she explained exactly what I meant by responsibility. You need to know what is good for you and do it. And what is good for you is exactly what she said. Changing your mindset, adapting your attitude, redefining your goals. Don't stick to what it was in the past. Be aware that now is a different game and you have to do whatever is required to keep on playing. That's exactly the responsibility I was talking about. Janneke, your example is awesome because you did everything that has to be done. And I don't know what were your plans before or what are your plans in the future, but you're dealing with the day-by-day situation, which is the objective. I mean, we can talk about ages. What is happiness? I mean, everyone wants to be happy, but what is that? I mean, day by day, guys, day by day, do what you want to do and feel good with what you're doing and be aware that you're doing your best. And that's it. You're done.
It's really great messages that I'm hearing today. Starting from, ask for help. You are not alone in this, and be responsible and take your responsibility. And you're allowed to be selfish, which also I love. I think there are just so very, very beautiful messages here for the people that are listening.
And the baby steps.
And the
baby steps.
Yeah, and I thought the teamwork Yolanda was telling us about, that's a very good one as well. It is teamwork. Everyone around you, not only family, friends, but also the neurologist or the other specialists around you. It's not a fight. It can feel like a fight maybe because there can be a situation where you don't want to have the diagnostic. Of course, we probably all think those things. But just know that everyone around you is there and tries to be open to help you and tries to be there for you. So yeah, the teamwork, I think that's it's a good one to be aware of.
But just before closing, maybe one last question. Something that you just mentioned about the teamwork and the process of the communication. It could be that at some point, the perception is that people are trying too hard and they don't understand you. And maybe, Yolanda, you might have heard that from the patients, that it feels like too patronizing, that they don't know how to help. They're trying, but not finding the right words. And it can be also a bit of a frustration. Do you have any recommendations for people that feel that they are not heard?
Well, you have the right to. So you are consulting health problems, and the professionals in front of you should listen to you. You have to be clear. Maybe sometimes my recommendation is to prepare a bit beforehand your consultancy. Make your mind clear. So the time is restricted. The professional is busy, but that's your time. And you should take advantage of that time. So if you can clarify your mind to explain better using that time, I highly recommend it. And if you have to take notes and, go to the consultancy with a piece of paper, that's fine, because it will save time in this kind of communication. And professionals, if you put on their shoes, probably they've been there the whole day listening to people like you with similar problems, and they're so trained to do that. But, they can be also burnout sometimes. And I'm not saying that's okay. They shouldn't. If I have a bad day, my patient wouldn't notice, because that's why I am professional. They shouldn't notice. But sometimes they might be. But that's your right. You have your time there. So the better is to communicate clear. And if you feel that they don't get what you want to express, ask them. I mean, please, I'm telling you, this is important, because the same issue has different impacts according to your own context. For example, if I stammer a little bit and, my only duty is to, I don't know, post officer, and I deliver post office information, whatever, I don't need to talk. It's fine. But if I am a teacher at university and if I stammer, that will have a really high impact on my day-to-day basis functioning. So the same thing will have different impacts, and you have to explain the professionals how big is that impact and why this is important for you. They may not know it, but you do. So if you feel they don't listen, explain better. Explain why that specific thing is important to you. At the end of the day, they will know, and they will try to help.
I'd like to add to that, but it helped me to write a letter to myself, and then I could show my letter to the specialist.
Mm-hmm.
Just write it down, take notes, take someone with you, and talk about it before you go to the appointment you have. But really write it down, and especially when it's mental health, all the emotions you have, or just all the questions in the whole process, of course. It explains a lot if you write it to yourself, if you get a conversation with yourself. It makes it more clear, and you told about clarifying your head and make space to think about it. I think that's maybe a good tip.
That's a brilliant tip. And actually now we have also tools like phone applications that can also help us to prepare for the visits with healthcare specialists. So it's also important, if we have these technologies available, to use them when necessary. And this one could be a perfect example. But thank you both for sharing these tips. Unfortunately, we are arriving to the end of our conversation. But before we leave, we will play a small game, and it's a fire rapid question and answer. So you will have to answer with the first thing that pops up in your mind.
Okay.
So first question, mayo or ketchup?
Ketchup.
None of them.
You were not expecting this question.
Can I say kimchi?
It's also an option. Yeah.
Okay, I stick to the options. Okay.
Perfect. So next one, Instagram or TikTok?
TikTok.
Oh, no, Instagram.
Oh, I don't have Instagram, by the way.
TikTok seems overwhelming.
Yeah, TikTok, it's really overwhelming and time consuming as well. Well, both of them are time consuming.
I know.
Next question. Favorite way to reconnect with yourself after a hard day?
Knitting.
Oh, good one. Music. Just listen to music.
Nice. Both of them are really nice ways. I would say eating popcorn or something like that.
Oh, that's also nice.
This one is for Janneke. So, best advice that you have received from an older person with MS on how to deal with MS?
Live day by day and see all those small baby steps you make in the process.
That's a really good one. And one last question for you as well. A message to your younger self after being diagnosed with MS?
Oh, it's gonna be okay. You'll get there. Just take the time, you'll get there. Don't be in a rush.
That's a beautiful message.
And important. And that wraps up this episode of Let's Talk MS. A big thank you to our incredible guests for sharing these tips and experiences. And as Janneke says, you're allowed to be you in just the way you are, with all your baby steps in your daily life. As we're coming to the end of our podcast, I would like to remind you that from the 19th to the 25th of May is the European Mental Health Week, an initiative to raise awareness of mental health in our daily lives. For the MS community, we also have another important date this month, the 30th of May, when we celebrate the World MS Day. We invite you to take part in the wonderful activities organized by EMSP and national MS organizations across the world. Let's continue to raise awareness and support each other. Please share this episode with anyone you believe could benefit from it. Subscribe to our podcast channel to be informed of our next episodes. In the next one, we will be diving into the topic of stigma and discrimination. You can follow us on our Instagram and Twitter accounts @EUMSYouth. Thank you for listening to our episode today, and until next time, bye!